Hello, everyone. I am Salim Virani, and I serve as Vice Provost for Research and Professor of Medicine at the Aga Khan University in Pakistan. We are so excited today to be talking about the 2023 American Heart Association and American College of Cardiology guideline for the management of patients with chronic coronary artery disease. Another really important lifestyle component when we are trying to prevent or treating chronic coronary disease is physical activity. And as a lot of you will notice, the guidelines have actually stopped using the term exercise. It's cumulative physical activity. So, as long as our patients with chronic coronary disease are free from contraindications, and those would include unstable angina, decompensated heart failure, uncontrolled arrhythmias, or acute thromboembolic disease, a good physical activity regimen is recommended for all patients with chronic coronary disease. So, when we talk about physical activity, there are four recommendations that are extremely important. First is that we recommend more than or equal to 150 minutes of moderate intensity aerobic activity or more than or equal to 75 minutes per week of higher intensity aerobic activities for every patient. Second, it is extremely important for patients with chronic coronary disease to actually supplement this aerobic activity with exercise that improves strength and functional capacity. And then those exercises have also shown to improve risk factor control. So, a combination of aerobic activity and muscle strengthening exercises is extremely important. We also have a class 2 recommendation for patients to reduce sedentary behavior. Now we know that 150 minutes is really where you get good amount of benefit. In fact, there is just a steep curve up to 300 minutes. But what we know is that for a person who is very sedentary, they can gain benefit even up to 150 minutes, even if they increase their physical activity by 10 minutes, 20 minutes, 30 minutes. Now, last but not the least, a class 1 recommendation that is extremely important, and we know that this is a problem in taking care of patients with chronic coronary disease, is recommendation related to cardiac rehab. We know that in patients who've had a recent MI, PCI, or who've undergone coronary artery bypass grafting, patients who have stable angina, patients who have had heart transplant, or patients who recently had spontaneous coronary artery dissection related event. In all of these patients, we have class 1 recommendation for cardiac rehab. And this is extremely important because we know that referral as well as continuation of cardiac rehab is extremely low in these patients, and we know that it improves control of risk factors, it reduces symptom burden, it improves quality of life, and for some of these conditions, it reduces mortality as well.